eggs are good, and if and when you need them, it's ready to go. But I think definitely we need to get this out into the community, that this is an option. Techniques have improved over the years. And, for women who are career women, which we don't really talk about, a lot of women are really into the professions. They're into, getting their education, doing their schooling. And then they finally come out and they're like, they're not married. And then they're like, okay, so now.
Yeah.
And then they're. Lydia's raising her hand.
I'm like, yeah, I'm one of those people.
And they're like, what do I do? I'm 40 now. Well, you say, well, it's okay. I've got some eggs in the bank. So if these eggs don't work, I've got other eggs that I can rely on.
That's a really great option.
I think it's a great option. It costs several $1,000s to do, but I think it's well worth it. And if having a child from your own genes is very important to you, people will go out and spend money on cars and things like that, but we need to spend money on ourselves and our future. So
that's your legacy.
And it's your legacy, yeah.
So
exactly.
Scale back on the car.
Yes.
And invest in your mini-me.
And invest in your mini-me, exactly.
That's how I look at it.
That's right.
And it's a great option. So thank you so much for sharing that.
Mm-hmm.
And let's talk about, it is Pride Month, and a lot of people, there's more. One of the things that actually comes up a lot is, same-sex couples who want to go through the process of having a child, together. So I think you mentioned something very interesting offline. For us, then the mainstream public, it seems like, oh, it's coming out more. And you were like, actually, no, this is nothing new. I've seen this a lot of times, actually. So shed some light on that.
I've had a number of couples, same-sex couples, who've come in and decide that they want to have children. Various methods have been used. I mean, for one couple that I actually got pregnant, it was a matter of they picked out sperm. It was all female couple, and they picked out sperm from a bank, and we used medication to induce them, and I triggered them, and then I inseminated them, and they wound up getting pregnant. And I see one of the partners all the time, and we talk about how the child is doing, and everything's going well, and everything's good.
That's amazing.
This is not new for us gynecologists, because we've heard this over the years, or we've been dealing with this for a while, but now it's more out into the public. It's more accepted, and so this is a good option for couples, same-sex couples, to do this.
Absolutely. We'll hold that thought. We'll take a quick break. We'll be right back. You're watching Beyond Focus TV. Stay with us. Welcome back. You're watching Beyond Focus TV. I'm Lydia Patel, sitting here with Dr. Suzanne Greenidge. So, Dr. Greenidge, let's switch gears a little bit.
Yes.
So, as a doctor, you're out helping so many different people, saving patients, and doing a lot of good stuff. But do you have a doctor as well? Do you actually go to a doctor and get yourself checked? I think a lot of times people forget that doctors need doctors as well.
Absolutely. I go to doctors every year. I have a schedule, which I work out around my birthday. I think that's a good thing for everyone to remember, that treat yourself around the time of your birthday, and go and see your gynecologist. Go and see your medical doctor. If you're a little bit older, you may want to go and see a cardiologist for various reasons, depending on your age and your history in your family. If you have any kind of colon cancer, you may want to see your GI or a gastroenterologist. And also, I actually go to a dermatologist every once in a while.
Well, look at you.
Yeah, I've had her for a long time. She always tells me, well, you don't really need me now. But I say, yeah, I want you to do a skin check, and I want to make sure that, I don't have any melanoma or anything that's going on. So I always encourage encourage my women to see various other doctors, such as especially gastroenterologists, because we want to check the colon and make sure that you don't have colon cancer. A lot of women have colon cancer in their family, and we want to know what diseases women have. So we actually do a genetic screen when women come in, and depending on what their family history dictates, for example, breast cancer, some women we encourage to do the BRCA or BRCA testing and check to make sure that they don't have a gene that would predispose them for more disorders or more cancers, basically.
So what does that mean when someone actually goes and gets that genetic testing and if you show that you have a gene? What does that really mean from there? That
means that they have a higher risk of having ovarian cancer, let's say, and what that brings on, a lot of other doctors will send their patients to me so that I can then go in and take out their ovaries and their tubes, because we now know that fallopian tubes cause the worst cancers or the worst ovarian cancers.
Wow, I did not know that.
So we actually, I have sometimes breast surgeons who will send the patients and say, we need you to, take out their ovaries or their tubes. Or sometimes I've had women who have been positive who wind up getting breast reductions because they have such a strong family history of breast cancer in the family, and they turn out to be positive. So they will wind up doing mastectomies and doing implants. And a lot of the surgeons in some centers now are really good at actually making your breasts better. They remove them and then they put the implants and make you better. And then you don't have that worry that, I may get the breast cancer down the road.
But taking off your breast, which is Angelina Jolie is actually a perfect candidate for that.
Exactly.
She actually went ahead. She has a very strong chance of getting it.
Right.
And she went ahead, took the breast off, has prosthetics. And but does that mean, okay, so you take the breast off, does that just mean the cancer will go to another part?
No. I mean, we're talking specific cancers that are specific to particular areas. So if you don't have your breasts, you're not going to get the breast cancer. And it's not going to turn into some other cancer, like cervical cancer. Yeah.
Because just word on the street, and that's why sometimes you speak to professionals like yourselves, amongst ladies. We're like, well, if you take that off, doesn't that just mean it's just going to go somewhere else?
Yeah.
And I'm like, okay, that's a good thought, though. I mean, I see the logic on it.
Right.
But confirmed now that no, that would not happen. So
Exactly.
That's actually great. So that's good. So you actually go and you get checked.
I
have
get
your
checked.
own doctors.
Yes, I have my
all those
medical,
good things.
my cardiologist, my dermatologist, and I would encourage everyone to see their doctor because it's all about preventative care. You want to make sure that if you do have something, and I always say everybody's going to get something, then it's worth it to know it early what you're going to get. If you have that breast cancer, you go for those mammograms. We haven't talked about getting mammograms, but I get my mammogram every year. I actually also do a sonogram because sometimes when women's breasts are dense, they have to get a mammogram and an ultrasound at the same time. So, use your birthday really to be that special time that you do all these things. I have patients that take, a day off from work and they line up all their doctor visits.
That's very true.
They do their medical doctor, they do their mammogram, they're off to maybe even a bone density scan. They're off to the GI doctor and to make their appointments. So everybody does these things a lot of times around the birthday is a good time to do it.
That's a good point. I'm actually going to start doing that. I do get checked, but I don't get checked as I should.
Right.
You kind of take it for granted. Oh, I still got time. No, time's running out. So you need to go ahead and do that.
Even if you're young, as young as you are, lady, you need to get checked because we want to, like I said, know. A lot of women. I had a 24-year-old who came in today, had no idea. She wound up with a cyst. When we did a sonogram, 11 centimeters. And she had all she had was lower back pain. That was it. And she had no idea. And she's only 24. So imagine me telling her, listen, you've got a cyst that's this big, like basically a melon. And she was shocked, and it explained some of her vague symptoms, but she didn't have pain per se to drive her to the doctor. So she came in for a routine checkup.
Wow.
And because she told me she had back pain, I decided, you know what, I think we should just do a sonogram, and there it was. So that's helpful.
I am actually going to come and see you. New patient. We love this. Tell everyone how we get in contact with you, where your center is located, and all that good stuff.
So Woman to Woman OBGYN is located in Yonkers. It's 1020 North Broadway in Yonkers. We also have another site in Corre, so it's 3050 Corre Avenue. We're located on the web, www.westchesterobgyn.com. We have a portal, and you can make an appointment through our portal. And we'd love to have any and all patients who'd like to come and see us.
Absolutely. I mean, I really encourage it because you really give so much information. I love the wealth of information that you've been giving to us. So it's such a blessing to actually have you here because knowledge is power.
Yes.
And I just actually want to highlight congratulations on the award that you recently received. That's
Thank you.
Amazing. What was the award?
Top Doctor.
Top Doctor, right?
Yeah. Great.
Oh, I could see why. I could definitely see why.
Thank
Dr.
you.
Greenidge, thank you so much for joining us here
so
again
much.
tonight.
It's been a pleasure.
And we will have you back. We want to get some more updates, probably focus in on one specific, a couple of hot topics for our viewers that are maybe fibroids or something that really is big in our community.
Yeah, that would be
So
great.
we will
and that's
zone
my
in.
one of my favorite topics, fibroids.
Okay, so you got it. We'll have you
Okay.
back for that.
Sounds great.
And as always, if you have any questions or comments, you can send us an email at info@beyondfocusmedia.com. I'm your host, Lydia Patel. Thank you so much for joining us, and we'll be back again next week, same time, same place. You're watching Beyond Focus TV. Stay with us.
Beyond Focus TV show wants and needs your feedback. Did we blunder? Please let us know so we can improve. Was the show helpful to you? Drop us a note so we can share the success with our staff members. Is there something you think we could do better? We welcome new ideas and new approaches to old ideas. Do you have a great suggestion? Let us know and we'll work on it. If you would like to share your comments anonymously, please send us an email at info@beyondfocusmedia.com. If you want to get in touch with the executive producer directly, send him an email at gene@beyondfocusmedia.com. We really look forward to hearing from you.